And I've started the recording. Uh, Good morning, everyone. Thank you for joining us today. This KSPAN sponsored workshop will provide you suicide prevention updates from the Kentucky Department for Behavioral Health, Developmental, and Intellectual Disabilities. It is my pleasure to introduce Beck Whipple from the Kentucky Department for Behavioral Health, Developmental, and Intellectual Disabilities. Beck currently serves as a suicide prevention coordinator within the Behavioral Health Prevention and Promotion branch. At this point, I'd like to turn over the webinar to Beck. Uh,
Excellent. Thanks, Steve. Thanks, KSPAN, for having me. Do incredible work, and I love to be a part of it as much as possible. So yeah, I'm Beck, and we are going to be talking today about what's going on in Kentucky related to suicide prevention. We'll give a update about some of the numbers for 2020 that we know. And so yeah, I'm excited to be here. Please ask your questions in the chat or on that question and answer panel, and Ashley and Steve will send those my way. We want you to be able to get what you need to get out of this. And yeah, I'm excited to be here and talk about all of the exciting things that are happening across Kentucky with suicide. I do also want to talk about that we are going to talk about suicide, and hopefully you're in a space, we're all in a space to be able to talk about and hear about that this morning. But if you're not, like Steve mentioned, this is going to be recorded, and you can catch us later, and always email me. But yeah, so take care of yourself this morning. Do a little body scan. Make sure you're in the right space to hear about this. Although a lot of it is very exciting because it's things that we're doing. It's the hope part that we're trying to infuse into a topic that's really hard to talk about and to learn about and hear about. So I want to just always put that self-care disclaimer out there. I'm going to share my screen and we'll get started. Everybody see okay? I don't know if you can actually, but yeah, we'll go for that until I hear otherwise. Okay, so.
Looks good, Beck.
Okay, good deal. So this is partnership is key. My belief and knowing as someone who has lived experience of suicide is that relationships and partnerships are suicide prevention, and being able to, on an individual level, on a family level, on a community level, to be in relationship and partnership during times of crisis are absolutely important. So partnership is key all the way up to our level of work, which is this kind of macro state level. So I'm excited to talk about a lot of the things that are happening. These are our suicide trends in Kentucky for 2015 to 2019. In the last couple of years, you'll see, things have been pretty steady, kind of actually going down. In 2019, we only had one age group increase, which was our 35 to 44-year-olds. We're really looking through some of these projects and grants and efforts. We're really looking to move more into the whole lifespan. So looking at those 35 to 64 or older, because that is a large number of our population. So we're seeing numbers in the right way as far as they're going down, but every single one of those numbers and these lines represent real people and real families across Kentucky. So I like to make sure that folks know where we're at, but also to really recognize that this data is people. These lines are people and families affected. So you'll see too that, just pretty steady, but we want to continually work together to partner to continue to bring these numbers down across Kentucky. So one of the things that is good to talk about is, kind of where we're at with COVID right now. And just the announcement yesterday that, we might be able to see some more recommendations or some more mandates related to COVID and, the holidays. So we're seeing, we're just really advocating for folks to be aware of their mental wellness and to do what we need to do. I kind of call it I'm COVID okay. I'm maintaining, I'm, doing what I need to do, but it's not anywhere where I want to be. And so, yeah, just being really mindful about this. We are, during COVID, have decreased numbers of suicides across Kentucky. And so that's like good news, is that the pandemic or COVID hasn't increased our rates, actually decreased our rates compared to 2019 and actually even the 3-year period before the average. So that's really good to know. We do have some areas of the state that we are always, that are up right now. New Vista area, so the Lexington kind of central Kentucky region, in the 17 counties that make up New Vista, and also our 4 Rivers regions. Those 2 regions of the state are actually seeing increase in suicides. So we're really trying to work with those regional community partners to see how we can, to see some things that we can do. We're also seeing suicides increase amongst our 24 and younger males. So that's an age group that, we are working with or trying to work with, because we are seeing an increase in that particular age group. So yeah, those are some of our for Kentucky, and I can, Steve will email these out and there'll be some more. But yeah, we're seeing and actually, if for 2020, and if you take January and February out of our numbers, so just the COVID months, March through, I think they go through September, you'll see a more significant decrease. We had a pretty hard January and February of 2020. And so, yeah, those are just some of the numbers, but again, just remember those are people and families and communities that are affected, and to do right now absolutely what's required of us to take care of our mental wellness and be aware of those, our mental health for those around us. So some of the things that have been going on, and this is the effective action part of my job. So these are the things that we can do to hopefully bring folks together and address suicide across the Commonwealth. One of the projects I've been working on the longest since I've gotten this job in September is what we call the Lifeline Capacity Building Grant. It's a SAMHSA grant that's really focused on building the network of nationally accredited call centers. So the National Suicide Prevention Lifeline, or NSPL, is the 1-800 number that you see on the screen. And it is one that's most frequently advertised for those in crisis, or someone that knows someone who is in like a suicidal crisis. So if you know someone and you don't know what to do, you can also call that number. You don't have to actually individually be in the crisis yourself. So I always like to talk about that. And while I'm doing this, if you pull out your phone, please put this number in your contacts. Save this number in your phone. I say pretty clearly, crisis is no time to be Googling. Yeah, so put it in your phone now while hopefully there's no crisis happening. And that way, when and if it does, which we never hope it does, that you'll have that readily available. So when I started with this grant, when our team started with this grant, we had an in-state answer rate of 48%. So when a Kentucky caller would call that number, 48% of the time that was answered by a Kentucky-based call center. And that meant over 50% of the time when someone called, they would be sent to a national backup center, which doesn't know Kentucky. They don't know our resources. They don't know our communities. And so this grant's efforts were completely to make sure that when someone in Kentucky called, that they would be answered by a fellow Kentuckian. So our National Suicide Prevention Lifeline centers are all in Kentucky, are part of the community mental health centers in Kentucky. There's 14 of them and they reach every county. We have now 9 accredited centers. So 9 of those 14 CMHCs have an accredited NSPL line. So if you are calling from one of those 9 regions, you are going to get a fellow Kentuckian. And that's really exciting. So this grant was used to expand to all 14. So the 9th one just happened as a part of this grant. And we have 2 other CMHCs that are in the application process. And I believe a 3rd and hopefully 4th will be coming online soon. So at the end of 2020, at the end of this 1-year grant, or at the end of year 1 of this 2.5-year grant, we now are up to 70%. So 70% of Kentuckians who now call a fellow Kentuckian enter in that line. That line is 100% confidential. It's free. It's 24/7. So we really encourage folks to make sure if you have any kind of brochures or any kind of things that you hand out related to mental health or anything, you just put this little logo on there. It's just something, a good reminder. We have seen during COVID about a 3% increase in our calls, and mostly those are in our Jefferson County, 7 counties area. So that's pretty stable as well. We have about 350 calls a week to our National Suicide Prevention Lifelines here in Kentucky. And yeah, Pathways just came on October 15th, and really appreciative of Governor Beshear mentioning that in his daily briefing and giving them a shout out for all of their hard work. So that's one of the big grants that we're working on, and it's going really well. The other thing that is not a grant, but actual appropriations from the tobacco settlement funds, and thank you to our legislation for allowing us to have the money or allotting us to have the money. We're working on what we call the Rural Suicide Prevention Project. And this is a true partnership. So if you can see all of the emblems on here, those are actual organizations that are represented in this project. And our whole goal in the suicide prevention, or the Rural Suicide Prevention Project, is to expand and really focus on how to prevent farmer and farm family suicide, stress and suicide. So we're working with our partners at the UK Southeast Center. We have some Dr. Susan Jones is at WKU, and she's creating a course that will be helpful. Department of Ag is a big partner in this. They're helping us with some media campaigns and just really pulling together also some advisory boards. So some commodities are represented on that board. So really just a great expansion of conversation around it, and a good group. Penny Royal, I'm going to click to the next slide because it kind of tells us a little bit. So we're going to have actually a farmer branded campaign. So it will really highlight the NSPL line, the suicide prevention lifeline. And it will also do a crisis text with a specific farmer kind of branded word, so that they can text Kentucky Farmer. That's not the word officially, and they can then we can see that, see the results of that. So we're excited about that, to have an actual brand that focuses on those farmers and their farm families. This project also will train some of our rule-based mental health clinicians in what we call AMSR, which is Assessing and Managing Suicide Risk. It's an evidence-based kind of clinical treatment or clinical framework to use. So we're going to be focusing on, I think, about 350 clinicians. We have that many spots to get our rural clinicians trained. This also meets our legislation requirement for their license. They have to have 6 hours every 6 years around assessing and managing suicide risk. So when we get those scheduled, I'll send those out. This project will train 40 new QPR, which QPR is question, persuade, refer. It's what we call a gatekeeper training. So if you think CPR for mental health, so it's kind of that really, it's a training to help us intervene when someone's in a crisis, a suicidal crisis, to help get them to the next level of support or care that they might need. So QPR is the CPR of mental health. So that we're excited to have 40 new specifically targeted trainers that have like direct contact with farmers, farm families, or the ag industry. So we'll and the QPR training will be farmer and farm family focused. So that's really exciting news. And we also have materials to help support that delivery of QPR. We're always trying to increase our surveillance. So, you know, being able to track in as much real time as possible the use of our emergency departments for suicide attempts or self-harm attempts. So this grant will help us expand into some of the new technology coming out of the CDC. It's a program called S. So we're really excited about that. Our Pennyroyal Community Mental Health Center has been a part of a grant that I just talked about, the NSPL grant. But they are going to help us make sure that all of our rural counties have either a primary or a backup call center to call for that 1-800 number. And so the Pennyroyal Center has agreed to be either a primary or a backup call center for all of our rural-based counties. And that way, when a farmer or someone in those rural counties are calling, they're definitely getting a Kentucky person to answer that call. So we're really excited to work with Pennyroyal on that. And Dr. Susan Jones and her team at WKU are developing and will be disseminating what they call the Kentucky Farmer Crush training, which Crush, I love this, is cultural respect, understanding, sensitivity, and humility. So really diving into what is stressful, what is hard about being a farmer or a farm family that might increase the risk of suicide or significant mental health challenges. So thinking about what is it about being a farmer. And so this training is for our paraprofessionals and also our professionals in the healthcare and also mental health care fields. We're really trying to increase awareness. A lot of times folks go to their physical doctor, their medical doctor, a week, a month, 6 months before suicide, complaining of a physical health pain. So we're really trying to increase the likelihood that in those incidents where they go to a physical or medical doctor, that they have a mental health screening or suicide risk screening. So that's one of the parts of the Crush training, which I'm excited about. So stay on the lookout for that, and I will be sure to disseminate it as soon as they have it developed. And this actually came out of focus groups. So Dr. Jones and her team did focus groups with farmers and their families across the state, and are using their words and their experiences to create this training. So excited about the Rural Suicide Prevention Project. I'm from a rural part of Kansas myself. I grew up in rural Kansas, so I'm excited to work with our fellow rural Kentuckians. So that was actual tobacco settlement funds. So this is another grant through SAMHSA. This is a COVID relief grant. We're calling it the Kentucky Emergency Response to Suicide Prevention. And this grant is focused entirely on Jefferson County or the Louisville area. Jefferson County or Louisville is being the hardest hit by COVID, as well as they have the highest number of suicides. So we are working specifically in Louisville with this grant to increase our prevention, intervention efforts around suicide. So we're working with the 7 county services, Center for Women and Families, Louisville Health Advisory Board. Actually, we have, this grant was able to work and provide a suicide coordinator within Louisville Health Department, Center for Health Equity. So Chelsea is awesome, and we are just starting to work together, and I'm really excited to work with her, as well as U of L Health. So this grant is really a pilot to hopefully some things that you'll see in the future. We're going to be hiring through 7 counties, so they're going to be 7 counties employees, but they're going to be working with individuals at the U of L emergency room that have had an attempt and have been discharged. They will do what we call a warm handoff to those peer support specialists. And those peer support specialists will be there to support that person, their family, to navigate the system, to make sure and increase follow-up to those appointments for aftercare. So we're using a specialized peer support kind of model where the peer support specialist is certified, they're working towards their certification, and peer supports are certified through severe mental illness, their own experience of severe mental illness, or substance use disorder. But we are adding a layer to these 2 positions that also indicate that that person will have a lived experience of suicide. So they will have had a suicide, they will have some kind of relationship with suicide in their life. So somebody who has been there, someone who has known what that experience is like, and then be able to help that person who's experiencing it now navigate the system, or be a patient advocate, or just being hope. The fact that that person is there to help and to talk with them is hope that things get better. And so we're really excited about that. The position at Louisville Metro will help us create a campaign, again, to advertise the suicide prevention and crisis text line numbers, as well as just kind of help coordinate trainings and all of those things. So our LHAB partners, Louisville Health Advisory Board, they trained almost 2,000 people in 1 week in QPR in 2018 as part of Suicide Prevention Week. It was a huge success, and so they have a lot of history and experience in rolling out trainings in Louisville. So they have been tasked with doing trainings. And so they have a budget to look at and roll out trainings in Louisville related to suicide prevention. So gatekeeper trainings like QPR, or actual clinical based trainings as AMSR and CAMS, which CAMS is a collaborative assessment and management of suicide, which is really all of these are evidence-based good stuff. So federally, part of this grant was that we work with a domestic violence shelter. So we're really excited to work with the Center for Women and Families to just help support them, provide the needed shelter, emergency shelter and services for those experiencing interpersonal violence. So we're excited and happy to be working with them and expanding their services and helping support their services, and then helping them think about how they interact with the people that are using their services if they are suicidal or are experiencing a suicidal crisis. And also, again, always increasing our surveillance. So working with our emergency departments to kind of track the use of their services and, demographically, regional, like what county are they from, or what zip code, what age groups are we working at, or are we seeing most often using the emergency department? So that's really important. So this is actually a partnership that we have with Dr. Ashley Bush, who's on, and Steve at KSPAN. So they helped and wrote this grant for us. It's a CDC COVID response grant that is going to be, and actually we have already 51 people training or slotted to do the QPR Train the Trainer in early December. So by mid-December, we're going to have 51 new QPR trainers through this grant, and it's also going to be able to support, again, the materials to help those trainers disseminate the grant or disseminate the trainings. And QPR is an hour and a half. It's great training to do for like a lunch and learn or a series like this where you don't have all day, but you want to be able to talk to people about how to intervene. And so it's kind of the precursor to maybe a mental health first aid, which is a 6 to 8 hour training. And so if you just have a short amount of time, this is a perfect one to do it. You also, to be a QPR trainer and to take QPR, you don't have to have any like specific education or professional like license. It is for everybody, just like CPR. We want everybody in our communities to hear and know about QPR. And so I mentioned a couple of times the crisis text line. So through this CDC grant with Dr. Bush and Kiprick, we're going to be able to have a Kentucky branded and specific dashboard. So our team will be able to see in real time the not the content of the text, but we'll be able to see the age range and groups of those using the crisis text line. We'll be able to see regionally where the crisis text line is being used, and also a real 50,000 foot view of some of the maybe suicide drivers. So some of that stress that is increasing the suicidal thoughts. So that we're really excited about that. And through that, you will also see that we will have Kentucky specific words. So right now, when you go to text the 741 number, it will say text home or text hope. Through this grant, we're going to get 3 specific words that are just for Kentucky. So it might be text Kentucky to 741 or some of those things. So we're really excited about using those branded words or those specific Kentucky words to target different areas, like so the rural suicide prevention stuff, and some other initiatives. So we're really excited about seeing that and being able to use that data. And all of this surveillance and all of this data helps us then target our prevention efforts. So, for example, I mentioned 4 Rivers earlier. So when we get this information, we can say, hey, all of our community partners in 4 Rivers, these are the ages, these are the genders, these are the, potentially even the counties that we're seeing the highest incidence of text or calls or emergency department visits. So let's use targeted interventions or targeted prevention to reach those areas, so that we can, because we know that group or that region is particularly struggling. So that's really exciting. We also will be able to train some more folks in AMSR SUD. So AMSR, again, the assessing and managing suicide risk, that's a training for clinicians or mental or folks, nurse practitioners, mental health clinicians, all of so those that have professional license can become and take let me back up. Can take assessing and managing suicide risk. But this state opioid response or the SOAR grant through our partnership with Kentucky Opioid Response. I know these are lots of words, but this grant is helping us train 40 new trainers in AMSR SUD, substance use disorder. And this particular version of AMSR really helps and works really well with courtesy relapse prevention, safety planning related to both suicide and substance use. And so it has a specific portion of the training helps those clinicians who are working with folks experiencing substance use or opioid use disorders. And so this training is training 40 new trainers across the state, and also will provide the materials. So we're really excited about that. Right now we have 8 AMSR SUD trainers in the state. So this will give us a huge increase in that number. We're really excited about. We're also working with our public health partners. I saw Tara on here earlier. So her team is working in a learning collaborative to address youth suicide. And this is what we're working on is implementing zero suicide. So if you don't know about the Zero Suicide Initiative or Zero Suicide Framework, please go look it up. It's great for any organization, particularly behavioral and physical health organizations, but it is really a roadmap to how you can get your organization trained from top to bottom, all up and down, in the best evidence-based intervention. So it's a great framework to use and it also is like a quality improvement. So you can, through this framework, you can go back and look at how are we doing with integrating this into our policies and procedures and all of those things. So our learning collaborative is looking at implementing zero suicide in 2 healthcare systems across the state. So in the Gateway region, which is I think Pathways in the community mental health world, so Ashland area, and then also in our River Valley area around Owensboro. So we're going to work with 2 hospital or healthcare systems in those to try to implement zero suicide across the hospital. So really excited to be working with them and their team. I'm a part of what is a governor's challenge. So we have 27, we're one of 27 states, and there's also a mayor's challenge that focuses just on city level. But this governor challenge team, which has partners all the way from the to higher education and to public agencies like the Veterans Club. Also, if you don't know the Veterans Club, look them up. Jeremy is awesome. He's providing support to veterans in that peer way. He's also a veteran himself. But this Governor's Challenge team has brought together a group of people, key stakeholders that are creating action steps. So we've created, I think, 3 to 4 action steps to roll out over the next year. And then to be able to report that to the governor. So the governor himself has said, hey, this is what I am interested in and passionate about. And so let's work together. So this is an incredible team of folks that are addressing suicide and suicide risk amongst our SMVF, service members, veterans, and their families. So very excited to be working with that team and see what happens with this initiative. Just yesterday or maybe the day before, there was a news release on this project. So we're working with Whitney Strong. Whitney Strong is an organization that is about ending gun violence, and that is also self-inflicted gun violence. And so Whitney Strong, ourselves, and the Kentucky American Academy of Pediatrics are working together to get 5,000 gun locks to pediatricians' offices across the state. Suicide by firearm is one of the highest means that we see in Kentucky, and it is also the means in which survivability is the lowest. So we're really trying to make sure that we are providing space and time between a suicidal crisis and acting on that crisis. And gun locks are a good way to do that. Keeping guns safely in your home is really important because we never know, like any crisis, we never know when it's going to happen. And so to make sure that we're doing that prevention of securing those gun locks is really important. So we're really excited about working with pediatricians and Whitney Strong on being able to supply those 5,000 gun locks to pediatricians. And also hopefully that also increases the likelihood that they're actually having conversations with parents about suicide and making sure they're aware of the warning and risk factors for suicide. So that's a lot of stuff that's happening. And we're really excited about all of the partners that we've created, that we're working with. And so, but one of the stables, one of the main folks that we use, systems that we utilize to roll this out is what we call our regional prevention centers. So again, just like those crisis call centers are housed in the community mental health centers, our regional prevention centers are as well. So we have an entire state net prevention specialists that are trained to work with communities. It's one thing for me to sit in my office and say, this is what we need to do prevention, but it's actually way more effective. Prevention science is way more effective if it's done at a community level. So if a community comes together and says, hey, this is what's happening in our community, and we as a community of people who are in relationship with one another, this is how we need to intervene on it. And so our regional prevention centers help facilitate that community process, and they provide technical assistance and trainings to help build those community coalitions so that they can be the drivers of change on a very local level. And so I say that because I always want to make sure that you know that they're out there, that they're an incredible network of folks that are doing this prevention work hopefully alongside our local health departments and our extension offices. So they're kind of all those community folks doing this work. So reach out if you don't know your regional prevention center staff. Reach out, let me know, and we'll be more than happy to connect you with them. I've been very blessed over the last year and couple months to meet them and to learn from them. I didn't come from background, and so they've been very gracious in helping me learn prevention. Yep.
Beck, we had a question from Charles Lay. He was wondering why the numbers go down during COVID. Would it be less stress from going into the offices or what?
Well, that brings up a good point. So thanks for asking that question. Suicide is not a one factor situation. So we have to be really careful in our evaluation of it and it simple for our own minds, because it's not a simple experience. So it's very layered, it's very multifaceted. But what we do know about disaster and disaster science tells us that after an event, community event, a national event, similar to COVID, or actually even after 9/11, SARS epidemic in Asia is something that we've been trying to look at as well, as a result of the effect on suicides during the SARS pandemic. But what we know is that there is a period of honeymoon after a situation like COVID or SARS or 9/11, where there's a sense of, kind of survival. We get really focused on surviving, and yeah, it does bring people together. There could be a bonded sense of, hey, let's get through this together. It definitely did for some people slow the pace of life down, and so we did kind of expect numbers to actually go down as a result. But what we're kind of working towards now is the period of disillusionment, where we do see an increase, and so we're really working to put efforts in place to minimize the effect of that disillusionment phase of disaster science. So I hope that answers your question. But traditionally, there's a period of about 12 to 18 months after a significant event happens like this, where we see an increase in suicide. So we'll be closely monitoring the numbers and also just really emphasizing prevention and intervention right now. Like, talk about suicide prevention, talk about your suicide safety plan now, before we get to that 12 to 8 month plan. It's kind of like, I mentioned yesterday in a conversation, it's kind of like to be happening now is your suicide emergency drills. So like we did fire drills and tornado drills in high school or in schools. We want, people, families, organizations to be doing these kind of regular conversations and check-ins about, hey, this is where you go, this is what happens, right? Again, crisis is no time to be Googling. So the more we can get folks talking about prevention and safety planning and normalizing help seeking now, hopefully the more effect we have on that 12 to 18 month potential increase, which, that's what we're working to avoid. That help?
I would just say, if it's all right with you, Beck, if anyone has a question, all they need to do is just raise their hand and I'll unmute their mic. And that way they can ask the question directly rather than having to type it in.
Yeah.
Or you can type it in either and I'll read the question.
Yeah, so also this is our last slide, so I want to make sure that we highlight our school-based interventions for our young people. So our RPCs that I mentioned earlier, they really try to work with schools and not just delivering the training, but helping the schools assess their policies, their procedures, their identification and early referrals. So again, making sure that schools, making sure that we all have pathways to care and that we know those pathways to care before we need them. Because the more confident and competent we are in being able to respond, the more empathetic and compassionate we can be when we need to respond, when someone's in that crisis. So these are our school-based interventions that we can provide either funding for or you know, our lieutenant governor, and through my coworker Kathy Pruthrow's work, our lieutenant emailed out the opportunity to do what we call Sources of Strength, which is a peer-led adult facilitated, you know, partnered group or training, not training, trying to find the right words. It's an intervention that schools can use to create a safer place across their schools. It's peer-led. It's about finding trusted adults. There's the wheel on there really targets different areas of a person's life. So Sources of Strength can be implemented both elementary, middle, and high schools. And so we do have funding through that, through our SOAR grant that I mentioned earlier. We also have a Lifelines Trilogy subscription that's available to help schools prevent suicide, intervene. Like I said, if a teacher or someone notices a child in crisis, that they can intervene appropriately. And then unfortunately, if they have a loss of suicide, a loss of a student by suicide, postvention is the best, safest, most evidence-based way of working with students in the school after a suicide happens. So we do have that subscription available that schools can use. And we also do Too Good for Drugs, QPR in schools, youth mental health first aid. But all of these are supported by looking at your policies, procedures, your trainings, all of those things. So and that is that with that. So I will stop sharing. This is my name and my email. So write it down, email me, let me know what you need. And if I can't help you, we will definitely point you in the direction of a community-based person that in your area that can. So
Beck, we have another question
absolutely.
from Shelley, Canada. Are there more women or more men who commit suicide in Kentucky?
Traditionally, men, male folks die by suicide more often. Again, that is most likely because they use firearms to die by suicide. And again, that's the least likely survivable experience model. Thanks, Kathy. So women and our female Kentuckians usually attempt suicide at a greater rate, but use potentially less lethal means. So there's opportunity for interventions. Other questions?
I'm not seeing any more questions, Beck. But if anybody wants to type them in, you can use the question and answer, or you can use the chat or raise your hand, and I'll be happy to unmute you.
So yeah, I do recommend waiting for people if they want to type their questions in. I do recommend talking about suicide with your family, with your close, you know, talking about mental wellness. Like I said, planning for. There are a couple of great apps. One's called My3, MY, the number 3. And it helps you to think about, like, if I'm in a not good space, who do I call? What do I do? You know, what are what are ways that I can reach out and not feel alone during this time? So, asking the question, that's one of the biggest things about QPR, is asking clearly and directly, are you thinking about suicide? Are you thinking about killing yourself? Is actually the preferred way to intervene with someone. But even before we get to intervention, I hope that we can have conversations with each other that are like, hey, if you ever get to this point, or, hey, what's your plan, to stay mentally safe? Do you have people can reach out to, or, if it's not me, put me on the list, so to speak. Really the work and having those conversations before, and then that way that person can, if they ever get to that situation, they can know, hey, Beck is a guy that is not afraid to talk about suicide. I hope that I can go to and talk to him about that. And individual example, not just in a professional capacity. So that's the hope. Renee, you asked about, can I elaborate more on the school related resources? So yes, so we do have a recommended, and I could send this out to Steve. We do have a recommended, recommended guidance for schools to do suicide prevention and intervention, postvention. So I can email that out, but there's legislation that requires everyone to do some kind of suicide prevention awareness by the 15th of September. So we work really closely with schools to be able to do that. Lifelines is really good because it gives teachers the materials they need to be able to have courageous conversations in their classrooms. And it doesn't put necessarily it all on one counselor or one school psychologist. I just recently learned that, that we don't have enough of those, right? But we also don't want to put it all on the teachers. So, but the Lifelines prevention part really gives, it's a manual, so you can actually read from and say, this is what I'm supposed to say. These are the things that we're supposed to address. It's accompanied by videos, by peers, for peers. So that's a really great prevention tool. Also, Dr. Damian Sweeney and Michelle Searcy have created a suicide prevention T for T that they have offered through KET. So I can provide that link too. Michelle is and works in JCBS and is kind of over the guidance counselors in JCBS and actually did the training herself and has had really great results in that. So we don't recommend in a school-based intervention to do those why are the words escaping me? Those larger group, like bring everybody into the auditorium or the gym kind of presentations around suicide prevention. We want it to be as safe and small group as possible so that we can monitor the response when we talk about suicide with young people. And again, this is about just making sure that they know, just like where they know where to go if there's a tornado, that they know and where to go if they're having a mental health crisis. We use the word trusted adults. One of the biggest protective factors in youth suicide is that they know who to go to, that they won't be judged or treated differently, but they'll be given support, and helping kids identify their own trusted adult. It's not me as someone as adult saying, hey, so-and-so is your trusted adult, but it's helping youth realize and look at and identify who they could go and talk to. School assemblies. Thanks, Charles. I was like, where is the word? So yeah, school assemblies, we don't recommend kind of talking about suicide in that way, because you can't keep folks mentally safe. You don't know who's being triggered. You don't know who maybe is experiencing that crisis in the moment. And so we do really encourage folks to do those in smaller groups, whether that the counselor go group by group or the teachers are equipped to have those conversations. but it's also to demystify, like, right, to talk about mental wellness isn't, you know, isn't as triggering, right? So we can have those conversations beforehand. It's really, really important. So thanks, Charles, for your help with words. I was like, it feels like the Monday, Wednesday, or Thursday. I don't actually got my COVID day of the week brain on. Other questions? And also, Renee, you know, if you want, we can talk more about what you have. If you have a specific need for a school, you know, Kathy Prethra who's on the webinar, works really well. You know, works really closely with our school and our RPCs that do a lot of our school-based interventions. So let us know how we can help with that. Other thoughts, questions, comments, concerns? So I will, in any of these trainings that we talked about that are going to be offered, or the trainers that are going to be offered, I'll make sure that Steve and Ashley have these, and that way they can send out to their KSPAN network. So if this is something that you're interested in, let us know, and you know, we can make sure you also sign up for the KSPAN, you know, listserv. Make sure you're on that. Hopefully you are, because you're here. But Steve and Ashley do an awesome job of disseminating that information. So I'll prioritize making sure they get it so they can send it out to you all if any of these things kind of sparked your interest. But suicide prevention is all of our jobs. It's not, you know, just because I have suicide in my job title, it's, you know, it's going to take all of us to create a network of safety for ourselves, our fellow Kentuckians.
If you would like to join KSPAN, you can go to the website. It's www.safekentucky, spelled out as all one word, .org. And at that site, you can find a link to join our listserv. It's free. All we ask is that you have a passion for prevention.
Yes. You might get to see my dog soon. Thanks, Kathy. I love working with you. We have a lot going on. This is a lot of projects, and it keeps all of us hopping. So other questions, thoughts?
I'm not seeing any more back.
Well, we might be able to give some people time back in their day.
Okay, if there's no more questions, then I guess we'll, as Beck said, we'll give you back part of your day. Thank you all. Thank you, Beck.
Yes,
Great
thank you.
presentation. Thank you.
Yeah, thank you very much.
Thanks for having me.
We did have a question from Rhonda. How do we get CEUs for today's presentation? Rhonda, regrettably, we don't have CEUs available. But if you need something to show that you did attend the webinar, we're happy to just email me or respond here, and I'll be happy to send you an email. Rhonda, I'll send that out to you.
I've never went through that training that fast. Hey, Dominique.
I'm going to start closing out if no one has any additional questions.
Yeah, sounds good.
You figured it out.
Yay.
We had to manually remove people.
Okay. Okay.
Well, I think where people log on, they walk away.
Yeah, yeah.
So I really miss the in-person meeting.
Oh my gosh, me too. Yeah, and even like I've noticed that like in there's a webinar, like, and I can't see people,
Mhm.
like harder to not get the feedback, you know?
Yeah, that's what we've been doing. Zoom webinar doesn't allow for participant videos for some interesting reason.
Yeah.
So I've been promoting everyone to panelists for the
Yeah.
QPR trainings, and
Oh,
then
nice.
sending a reminder email to everyone to have their cameras ready and functioning so we can
Yeah.
engage.
Yeah.
Since it's interactive.
Awesome.
So I think it's a weird attribute of Zoom webinar.
Yeah. Yeah, for sure. For sure.
But we thank you so much for doing that.
Yeah, I appreciate
Thank you, Beck, because it was really good.
And we also, I have a question. For the QPR, I've been asking groups who would be interested in having one.
Mm-hmm.
A couple of those are respondents are like Western Kentucky or Southwestern Kentucky schools.
Mm-hmm.
So is Kathy my contact I would talk to for the QPR, or can we, do you all have an ongoing training that we
Yeah.
could deliver and share and just connect
Yeah,
with the appropriate parties?
yeah, I would, myself or Kathy could connect, like, depending on what counties they're in,
Mhm.
that we can connect them to those RPCs because all of those RPCs have QPR trainers in them.
Okay. Do they have a specific